Hi everyone, I'm Dr. Barrett, and this video is intended for my patients exclusively. If you've had surgery by another surgeon, please make sure to follow up with that surgeon for particular details about your surgery. And if you're having a medical emergency, please dial 911 or go to the nearest emergency room. Hey everybody, it's Dr. Barrett, and you have just had a tummy tuck. Hopefully you're on your way home or at home listening to these instructions. First thing I want to say is congrats, you did it. I'm going to go over all your post-operative instructions here, so take notes and let's get started. This is one of the biggest operations that we do, okay? So there's a lot of things that you want to pay attention to. The very important things that I stress for all my patients are to walk around, stay mobile. The biggest thing that could happen to you that I can't fix is blood clots, all right? These can happen in your leg and they can travel to your lungs and they can kill you, all right? So take this very seriously. The same day of your surgery, get up, walk around. I don't care if you're hunched over. I don't care if it's just a 3-foot circle. Get up and do that at least once before you go to bed tonight, and then 3 times every day. Don't walk more than a mile, but getting movement back into your body helps prevent blood clots from forming. In addition, there should be compression stockings on your legs. Ideally, you can keep those on for about 3 days. Those actually help prevent blood clots in your legs from forming from the time of surgery and can be safely removed after 3 days. The second most important thing I tell all my patients is make sure you stay hydrated, all right? Sometimes you get nauseous after a surgery like this, and we do a lot of liposuction, typically with a tummy tuck or without it. Either way, your body can third space and you lose a lot of fluid in your body. You don't even know you're dehydrated until it's too late. Then you get nauseous and then you can't eat or drink anything. So stay ahead of that. Gatorade, Pedialyte, water, all right, soups, all that stuff is great to keeping you hydrated the first 24 hours. You want to make sure that you start peeing. If you start peeing, then you know that you have enough fluid on board. After a tummy tuck, it's normal to have some pain, okay? The first 3 days are the worst, and we recommend all of our patients to get Exparel. It's a long-acting pain medication that we inject along your plication if you do get a plication and your incision. Either way, you still might have some pain the first 3 days, and if you do, there is Norco, which is a prescribed pain medication that you can start taking, although I recommend you try to take Tylenol and CBD first to help with that pain, and then if you need to, use the Norco as a last resort. You will have some swelling, and that's okay. That swelling might extend upwards or downwards as gravity takes its toll. You might even be hunched over for the first few days. I want you to stand up straight over 5 days. Do know that it's normal to have swelling above your incision for up to a year, and on the corners of your incision up to a year. There might be some extra skin there. The swelling on the top part of the abdomen slowly starts to resolve as the lymphatic channels start to regrow beyond the incision. I recommend to take CBD during your postoperative period. It's normal, especially after such a big operation like this, to go from here down to here. Right about 2 weeks, you start to feel anxious and depressed. And then right around 2 weeks, you'll start to turn that corner and start going back up to normalcy. So if you feel down on the dumps, if you feel like crying, get some support, but know it's just temporary and we're gonna get you through it. Everybody, I'm Dr. Barrett. I'm going to talk to you about drain removal and drain care, okay? This is our patient here. She is 1 week out from surgery. She had a tummy tuck procedure. We put in 2 drains. I feel that drains are necessary because it helps drain off some of that bad fluid that builds up otherwise, okay? So when you go home with your drains, you want to make sure that you keep track of your drainage output, okay? So you can see that there's one side here is her left side, and then that's her right side there. So her left side is actually lowering down enough, which is what I'll check. So make sure you keep your drain log and bring it to your doctor. And I'll check and make sure that the amount is appropriate for a removal. When you go home the day of your surgery, you want to make sure that your drain is on suction, okay? And then it's building up fluid, okay? So if it's not on suction, this is a way to relieve it, this little white cap. You want to squeeze it, it's kind of like a little grenade. Squeeze it like that, and put this back on so that now it maintains suction. So you want to make sure that you empty it at least twice a day. And if it fills up, you know, make sure you empty it and put it back on suction. Now, one of the things you want to do at least once a day, take what I like to do is a little antibiotic ointment, and you kind of helps you slide your fingers along the tube. So take the pressure off of that and then slide here. You see how that just brought extra fluid in there? And in case there's any extra blood clots in there, that helps get that out. So make sure you record your drain output and you drain this fluid out like this. Okay, that's called milking the drain. Now, the next step we're gonna do is actually remove the drain, which is a painless procedure, okay? The older drains used to be painful. They were square, and you pull them out a round hole. It makes sense, that's gonna hurt. Now the new drains are round, they're like a noodle, so the noodle just comes right out, okay? So we're gonna do that right now. We're removing this stitch. And that's the hardest part, okay? We're going to release the drain from suction like this by venting it, okay? What the venting does is it takes it off suction, so we're able to kind of gently pull it. All right, take a big deep breath, and then here we go, nice big pull. And it's out, okay? So a little bit of stuff that comes out with it. Was that painful?
Not at all.
There you go, folks. Drain removal is a very simple, easy, painless procedure, okay? And it's nothing to be worried about. It serves a necessary function of draining off the fluid. Now she has one drain left. We're gonna take that out most likely next week, but we're gonna follow her drain output. We wanna make sure that she records her drain output appropriately so that we know when we can remove it. Generally, I like to wait until it's at least 20 cc's or less per day for 2 days in a row. If it's not, then we have to push it back to her next visit. Now, if you have a little bit of leaking around your drain outside your body, just reinforce with gauze and come show it to me at your next appointment. Not a big deal, okay? If you really pull on your drain and it pulls all the way out, not a big deal as well. Just give us a call, let us know, cover it with gauze, it'll be okay. If it partially comes out, leave it in place. Reinforce it with tape. A partially inserted drain is better than no drain. And remember, if you have no drains and the fluid builds up, we have to stick a needle in to drain off serous fluid every 3 days. It's important the first 24 hours to make sure you have somebody with you. You can easily get lightheaded after a tummy tuck procedure, and as you walk to the bathroom, you can fall over and hit your head, and then you have a head injury, okay? That's why someone needs to be with you and escort you to and from the bathroom and walking around the first 24 hours. I'm a big proponent of scar management, all right? You wanna use the Scanuva twice a day on your belly button after 2 weeks, okay? 2 weeks you're gonna do the antibiotic ointment, and then after that, if it looks clean enough, we can start to do the scar gel on your belly button. In addition to that, we're gonna be taping your incision for 6 weeks. We can't tape the belly button, so one of the things that we do recommend sometimes is this little belly button sphere. It's a silicone sphere. You wanna put it in the belly button and tape it there for 24 hours a day. That's gonna help create a more natural belly button, so be sure to ask for this at your week 2 appointment if it's needed. Some people don't need it, but many people benefit from this sphere, and I can tell you at the time if this belly button sphere is gonna be right for you. So right around 2 weeks, you can start to undergo adjuvant therapies such as venous Legacy skin tightening treatment, which has pulsed electromagnetic fields. Make sure you ask about that. It's a series of 8 treatments. It feels wonderful, speeds up your healing, and optimizes your liposuction result as part of your tummy tuck. In addition to that, we also recommend lymphatic massage that can start at 2 weeks if you feel up to it. A lot of our patients swear by it, and it helps their swelling improve immediately. If you feel in the areas of the liposuction on the flanks that might feel areas of knots and firmness, you want to massage those twice a day in circular motions. I tell people if you take a shower, hop in the shower, massage 3 times in the area just to let it settle in, and that will help those little knots from the liposuction resolve faster. If you're getting a major body procedure like a tummy tuck or body lift or multiple site procedure, we recommend that you get one of our post-op recovery kits. It has everything you can possibly imagine you'll need after surgery, including gauze, medical supplies in here, saline, hand sanitizer, sleep mask, earplugs, you name it. It is personally picked out by me so that you have everything you need to heal and recover and take care of your body after surgery. So I want to talk to you about some products that you should be taking after your surgery. It's really important to help you heal and help manage your symptoms. The first one I love is CBD. Okay, I recommend this product, Wild Health CBD. You take a full dropper, put it underneath your tongue right when you get home, and a full dropper right before you go to bed. You can actually increase as needed. You will sleep like a baby, and it'll actually calm your anxiety and calm down your pain to a manageable level. Magnesium is a great supplement for tummy tuck patients for 3 main reasons. First, it helps control the muscle spasms that you get after the plication is performed. Those muscles are brought together and is often very tight, and that can be experienced as pain after surgery. Second, it helps with constipation, helps keep you regular. And third, it helps you sleep at nighttime. The best way to take this is 2 of these capsules at nighttime right before you're about to go to bed. Arnica, this is a product we recommend. It has arnica and bromelain in it, so that helps the swelling go down naturally, and it helps the bruising. What else do you need to take? Well, there's a product I also recommend. It's called Heal Fast. It's a vitamin supplementation that's designed to help you heal right after the surgery so that your body has the necessary nutrients to heal. You need to take 5 of these twice a day. I know that's a lot, but you need all of these nutrients to heal and to detox your body from the anesthesia. The other product is Masszymes. It has a whole host of enzymes, digestive enzymes. You want to take 4 of these pills with every meal to help break down the food and help decrease your body's inflammation so that you heal faster. You can absorb the nutrients and it decreases inflammation in your body. This stuff has been proven to speed up your recovery. It is a must if you're going to have any surgery by me. Lastly, scar gel. Pick up the Skinuva scar gel. You want to use this on your incision twice a day. The reason why I like it's got silicone and a bunch of other fetal growth factors that help the incision heal. This is an abdominal binder, okay? This is going to go around your waist, and it's important not to put it on too tight. We don't give this to you right away after surgery. We give it to you 2 weeks after surgery, and it just needs to be snug. If it's too tight, you're going to cause little creases along the binder ridges that might leave a permanent mark on your body. Some people can develop an allergy to the binder because it has elastic fibers in it. If that happens, it develops as a diffuse rash in the area of the binder garment. If that happens, make sure you discontinue the binder and wash with soap and water. You only need to wear your binder for about 2 weeks. So what you can do beyond that is to wear Spanx or compressive garments that can help from the legs up. Okay, Spanx is our choice. It is compressive, but it's not too tight and it's very soft. After your tummy tuck, I want you walking right away. First 2 weeks, just walking. Don't want to raise your heart rate up. Be careful going up steps. You don't want to get that heart rate elevated. If you are going up steps, just take your time. Okay, you can get some bleeding if your heart rate goes up. At 2 weeks, you can actually start to do exercises. I would just do isolated extremity exercises or isolated leg exercises. Going up steps for a workout or walking incline to get your heart rate gently up is a good idea. Nothing more than that. At week 4, you can do a little gentle jogging, a little more rigorous activity. And at week 6, you can actually do core and upper body lifting and weights. But you want to use your body as a guide. Remember, we did a lot of abdominal work. Gentle is the way to start out. And if something hurts, take a few days off. So you want to be careful when lifting children. Use your arms, wrap around them, and use your legs to lift up. Sexual intercourse can resume after 2 weeks. I want you to sleep upright in bed for the first 3 nights, and then I want you to slowly start coming back down flat. If you sleep upright more than the first 3 nights, then you're going to start to have lower back pain that's going to drive you insane. It's important to use antibiotic ointment on your belly button twice a day after surgery. I recommend not to use Neosporin because it has neomycin, and that can develop an allergy to the belly button area, and that shows up as little red dots. If you do see that, make sure you use bacitracin or double antibiotic ointment or polysporin. I want to talk briefly about Steri-Strips. These are covering your incisions. If they fall off, no big deal. You want to replace it with a Band-Aid, all right? Now, sometimes your body swells with the Steri-Strip on it, and if that happens, it can form a blister, all right? And if that blister happens, that's okay. Leave it alone. You can put antibiotic ointment on it twice a day, and we will remove the Steri-Strip in the office. If you get an allergy, it develops a severe rash that's red and insanely itchy, okay? It happens on all the areas where you see this Steri-Strip. If that happens, remove all your Steri-Strips, wash with gentle soap and water, and take Benadryl and Claritin to help ease the symptoms. If you have any questions, give the office a call. We close your incisions in multiple layers. The deeper layers are using absorbable sutures to hold your wound together. Sometimes your body extrudes those and spits them out in a slight inflammatory reaction. And if that happens, it's not a big deal. It happens to about 20% of our patients. If you do see that happening, give us a call. We can take it out in the office, or if you feel comfortable, you can pull it gently with a pair of tweezers and trim it with beauty scissors so that it dives down below the skin incision, and then cover with antibiotic ointment for a few days or Steri-Strip. When to call us. If you're having a fever over 101 degrees, give us a call. The body temperature varies anywhere from 97 to 99 degrees, that's normal, but once it goes over 101 degrees, that's a potential problem. Also, if you have any significant bleeding or purulent drainage from any of your incisions, let us know. A little bit of bleeding is okay. A little bit of clear fluid is totally normal from a liposuction procedure. That's okay. But if you're getting a lot of bleeding or swelling in the abdomen area, that could be a sign of a hematoma. Now I'm talking like grapefruit-sized swelling. Okay, not talking about generalized swelling. If you haven't urinated in 12 hours after your surgery, you need to give us a call or call 911 or your nearest emergency room. If you are persistently nauseous, vomiting, and you can't keep anything down, you need to give us a call, call 911, or go to the nearest emergency room. Congratulations, you guys. You just had a tummy tuck and you are gonna do great. Hang in there. It gets better day by day. And just remember that at the end of all this, you're gonna look back and forget all about it because you're gonna have that great beach body and you're gonna be loving your new look. Be sure to tag us in your recovery process, #Barrett Recovery, so that other people can be inspired and learn from your journey.